Welcome to Lesson 3, Writing Learning Outcomes. This lesson will guide in writing appropriate learning outcomes. So, let's get started. Let's get to definitions first. Learning outcomes or LOs describe student learning, what students will know and be able to do as a result of completing a course or module or program. LO is a level of performance or achievement. Outcomes is for measurement or quantification of application or performance. Learning outcomes should be described in measurable terms using characteristics that define expectation of students at the end of the course or program. The key to measurability of a learning outcome LO is the active verb that describes an observable behavior, process or product. So what are SMART LOs or SMART learning outcomes? The LO should be specific and not ambiguous. The behavior or demonstration of knowledge should be clearly displayed and hence observed. Measurable. The LO should indicate what is to be measured and it should be quantifiable. Example for using a rubric. Attainable or achievable. The outcome should be achieved by the students for whom the LO is intended. The LO should be realistic to be attained and also present the student with a challenge to attain. Relevant. The LO should be relevant to the student's overall goal, which in turn is linked to the course or the program they have enrolled in. Time frame. The LO should be attained in the given time frame of the course or the program and will depend how complex or broad it is to accomplish and the various learning resources that are required to finish this. LOs or learning outcomes should be specific and measurable. Let me just focus on the first two attributes, specificity and measurability. These are important for me as the other three attributes can be modified to be attainable, relevant and time bound. For example, reflective experience is very vague as a student can even relate the experience of going to the mall. It can be a bit more specific as in the statement here. The student reflect their experiences on a visit or if need be to give more specificity. Further, this can be measured or evaluated based on a rubric or feedback given. Understanding is an invisible activity, but to show understanding, you need to demonstrate. Explaining plaque hypothesis or applying the knowledge of plaque hypothesis and developing an educational brochure for a patient can be a specific and measurable learning outcome. Let us understand what is measurable and unmeasurable verbs. If the behavior or knowledge can be tested and graded, it is measurable. Understand implies that the student knows the meaning, reason or effects. But to show that he understands, the student should explain. So explain is an action verb which can be measured. Did you understand tooth development? Yes. Then explain tooth development. Instead of appreciate the value of patient's autonomy, recognize patient's autonomy and dental care is a better verb. Recognize can be assessed, for example, by showing a video interaction between a patient and a dentist and identifying dialogues emphasizing patient autonomy. Be aware of the professional responsibilities of a dentist. This can be changed to a better verb like choose the required qualities of a dentist that will reflect professional responsibilities. What are the parts in an LO? So based on the previous attributes, let's explain the parts of an LO. The action verb is usually the starting point of an LO. It tells the observer how the subject or the student will demonstrate the required knowledge, skill or behavior. The key word here is the verb that should be chosen so as to be observable. The student can demonstrate his understanding by explaining, so explain is the preferred verb over understand. The second part of an LO is the statement on what the knowledge, skill or behavior is going to be based. For example, it can be knowledge on the materials used for caries prevention or skills to prepare a cavity. Third part is the context in which the student has to demonstrate the expected learning. For example, it can be to prepare a cavity for an IC-DAS code 5 carious lesion or remove calculus using hand instruments on a mannequin. The fourth part is the level to which the action should be accomplished. For example, no visible carious lesion and pulp exposure can be a level for preparing a cavity. Absence of calculus or plaque can be for scaling. The above four aspects can be used as a checklist when LOs are being prepared and reviewed. The level of achievement in context of the skill or the psychomotor domain can be a little different. This can be phrased based on the following questions. How much autonomy does the student have? How complex is the context they are working in? How much originality do they have to show? These three questions can help us to write the level of attachment for a skill outcome. Partial learning outcomes or partial LOs. Write partial LOs consisting of the active verb and the expected knowledge or skill or behavior. The context and the level of attachment can be added later. Some example. List the emergency medications required for the management of a dental patient at risk for epilepsy. List is a level 1 verb in cognitive domain. Demonstrate removal of caries in a natural tooth. Demonstrate can be a P4 verb in skill domain. Identify the learning goals in order to become an advocate for protecting patients' interests. Identify can be an A4 in affective domain. The LOs written should be reviewed if the verbs and the statement of knowledge and behavior are congruent. Also, the completeness of the LOs for the effective learning of the course outcome should be reviewed. Let's complete the LOs or the learning outcomes. The context or setting at which the learning would be done or exhibited is added to the partial learning outcomes developed before. Further, level of attachment is added as necessary. So let's review the examples again. Demonstrate the complete removal of caries in a natural tooth under simulation conditions in a mannequin. Red colored, the complete is the level of attachment expected, while the context is in simulation highlighted in blue. Demonstrate appropriate professional behavior towards support staff in a dental clinic. The word appropriate will be the level of achievement and can be assessed with a rubric, while support staff in a clinic will be context or situation. The LOs written should be reviewed to check if the level of achievement and context is suitable and applicable to the level of students intended. Now let's develop a checklist based on the criteria we discussed for writing an LO. It will help us evaluate the LOs. The LOs should be in the context of student learning than being teacher-centered. It is not how the teacher will teach. It should be more on the students, what will be offered to the students or what they might experience in the course or do during the course. A clear statement on what the learner or student will be able to do or show after attending the educational activity. This statement can be on knowledge, behavior or the skill. The behavior or skill or knowledge can be demonstrated to be observed and measured. Here the active verb for showing the achievement is important to indicate that the learning be demonstrable. Further, the criteria of learning should be measured by appropriate tools. The depth of learning or the level of learning to be achieved should be clearly stated. Finally, the context or situation where this learning can be demonstrated to be observed and measured should be stated, like in a community or in an interprofessional hospital or dental clinic or classroom, etc. Come, let's look at some examples and see how we can improve them on. Perform administration of topical and local anesthesia. Let's see how this can be improved using the checklist. It is in the skill or psychomotor domain. Student-centered? Yes, it is student-centered as it is related to the student performing the anesthesia than the teacher teaching it. The skill is stated, that is the administration of anesthesia. Performing anesthesia can be observed and measured using a checklist or rubric. Level of achievement and the context is missing. Let's modify that. The level of achievement is successfully highlighted in red. It indicates that the outcome is not achieved till the anesthesia is not achieved in the patient, as per a rubric. For example, lip, tongue numbness, as in an inferior alveolar nerve block. The context is in a patient treated in a dental clinic. So, the modified outcome would be perform successfully the administration of topical and local anesthesia in an adult or child patient requiring dental treatment in a dental clinic. The second outcome which we can modify. Understand the use of dental material science in relation to the treatment of pulpal and peri-apical diseases. It is C2 and is in the knowledge domain. Yes, student-centered. It's definitely student-centered as it is related to the student having knowledge on the use of dental materials. The knowledge is stated and it is the use of dental materials. Understanding in a student cannot be observed and hence cannot be measured. Level of achievement is not stated. Context is given in relation to the treatment of pulpal diseases. Let's improve. Active verb of apply is replaced so that this activity can be observed and measured. Level of achievement is appropriate as highlighted in red. It indicates that the outcome is not achieved till the student correctly selects the appropriate material for the condition and can be assessed with a rubric. So, the outcome would be modified as apply knowledge in the appropriate selection of dental material science for the treatment of pulpal and peri-apical diseases in the C2 level of knowledge domain. So, coming to the third outcome to be modified, it is in the affective domain. Display professional behaviors in a medical hospital setting. It is in the A3 level of affective domain. Yes, it is student-centered. The type of behavior is stated, professional behaviors. Can it be observed? Yes, by a peer, support staff or supervisor. Level of achievement is not given. So it is difficult here to put the right words. We cannot say correct behavior as it may change with settings. Context, yes, it's given. The context is in a medical hospital. So adding appropriate might be a good compromise to evaluate the level of achievement. But the rubric need to be generic on the principles of professional behavior than very prescriptive. So display appropriate professional behaviors in a medical hospital setting would be the modified outcome. So let's summarize. The learning outcome should be complete according to the checklist criteria. It should be reviewed to be on the SMART checklist criteria, complying to the SMART checklist. A complete, properly constructed LO or learning outcome provide guidance to the lesson planning and assessment.